Healthier Together, sponsored by Regence Blue Cross Blue Shield of Oregon.
Just that overall awareness of how to take care of your heart and the things that you can do for prevention, it's very important. And, especially for people of color, definitely need to focus on it.
In today's Healthier Together, we're focusing in on American Heart Month and the impact of heart disease on Black communities. Heart disease is the leading cause of death in the U.S., and the statistics are even more serious for Black folks. African Americans are 30% more likely to die from heart disease than non-Hispanic white people. Nearly half of all African American adults have some form of cardiovascular disease, including heart disease and stroke. And social factors play the biggest role in shaping people's health. Things like money and resources, education, quality health care, a safe living environment, and access to nutritious foods. Tanya Adams is the Chief Health Services Officer for Regence and a board member of the American Heart Association.
Many of them fall into the category of socioeconomic, and so if you think about some of the neighborhoods that Black Americans live in, they have sometimes food deserts, don't have access to good health care, that sort of thing, lots of stress from financials, and then sometimes obesity, etc. And you put all of those factors together, it just increases the chance of having some type of heart problem, whether it's stroke, heart attack, etc.
High blood pressure is the leading cause of heart attack and stroke in the U.S., and there's a disproportionate impact on Black women. African American women are nearly 60% more likely to have high blood pressure compared to non-Hispanic white women. Nearly 58% of Black women over 20 years old have high blood pressure, and only around 20% of those women have their blood pressure under control. Cardiovascular disease kills more than 50,000 Black women every year, and stroke is the leading cause of death among Black women.
Know your numbers. And so if you don't have a blood pressure monitoring cuff at home, get one. They're fairly inexpensive, and just know your numbers and monitor it regularly. And so 120/80 is where you want to be. If you start creeping up a little bit to 130, be concerned, take all those precautions, if you will, to make sure that you're maintaining your heart health.
Know your family's history and get to your doctor for those annual visits. And of course, remember, a healthy lifestyle is a big factor in prevention. A nutritious diet and regular exercise.
And then I can't underscore enough, exercise. It's really important that you get out and exercise and help yourself, and then eat right, of course. Do all those things you can to help prevent any heart attacks or other heart problems.
And we have links to more resources about heart health at kgw.com/healthiertogether.